Assalamu alaikum. I'm Dr. Laila Tharwat. I am a lecturer of Hematology Clinical Pathology Departments, and these are my contacts, email and cell phone number. If you have any questions, you are welcome to ask me anytime. I'm going to give you like an introduction or like I give you a background about the laboratory investigations and what you have to know about different investigation we are doing in the lab. So as a content of our lecture, we need to know why we need a laboratory investigation, what is meant by laboratory investigation, and the different applications, the classifications, or what are the different types of laboratory investigations we are doing, different questions and answer before doing or ordering a lab investigation, the most common types of laboratory investigation and common clinical scenarios, and at the end, the conclusion and references. So first, in order to know why we need a laboratory investigation, the different evidence showed that case history and clinical examination usually reveal that most of it, not all clinically relevant data. So for example, if we have a patient and from the history and the examination, we cannot do a final conclusion about this patient or final conclusion about the diagnosis or the most common differential diagnosis. So here start to be the role of laboratory investigation. So there is a need to confirm our clinical impression by doing laboratory investigation. So laboratory investigation is a supplementary method for gathering information. It is a known fact that with the help of lab investigation, some underlying system conditions of which patients are unaware of are often identified in clinical practice even for the first time, as well as help in prognosis, response to treatment, and even for follow-up. So laboratory investigation is completing the cycle for confirming or having an impression about the diagnosis or follow-up of the patient, checking the prognosis of the patient, or checking if this patient is responding to treatment or he is compliant to treatment or not. Okay. The definition, or in other words, what is meant by laboratory investigations? They are laboratory studies which are an extension for physical examination in which tissue, blood, or urine or other specimen are obtained from the patient and subjected to different investigation or different tests or investigation to confirm the clinical impression about our patient. It's either microscopic, biochemical, microbiological, or even immunological investigation. The information obtained from this investigation help us or help the physicians in identifying the nature of the disease. The different applications of laboratory investigation, they are confirming or rejecting a clinical diagnosis. For example, if we have a big list for differential diagnosis, we can either minimize our list or even confirm or reaching a final diagnosis, providing suitable guidelines for patient management. Actually, when the first the first successful treatment is to reach successful diagnosis, providing prognostic information of the diseases under consideration. For example, if we are dealing with certain diseases like leukemia or like that, we can know that this patient will be a good responder to chemotherapy or not from a specific investigation, establishing normal baseline value before treatment, and this baseline value is very, very important in establishing a follow-up or curve or whatever, checking if the patient is doing better, responding well, if we would like to change this kind of treatment, and the patient is responding well with this kind and is not responding and need to change the line of treatment we are using, monitoring and follow-up therapy, providing information for medical legal consultation in certain conditions. Next, going to the classifications of different laboratory investigation we are doing, both it's based on different criteria. For example, or we have different classification, and everyone is based according to different type of classification. First, if it is based on where the investigation is done, it's either chair-side or bedside investigation, and the other one is laboratory investigation. Chair or bedside, this is the type of investigation which is done besides the patient, and we can have the results as inset while the patient is at the same time, like for example rapid sugar evaluation, or in certain condition we have certain type of investigation called the dry chemistry. We can know the result at the time. The laboratory investigation, these are the different type of investigation done in the lab, and they are having higher sensitivity and specificity more than the chair side or the bedside investigation. If we have another classification based on the specificity and sensitivity, we have different type. We have screening tests and we have diagnostic tests. Screening tests, they are ideal screening test is 100% sensitive, but if we have a diagnostic test, it should be 100% specific. The screening test, it is the one done on a large sample size, and typically they are cheaper one, like blood glucose estimation for screening for diabetes, screening for anemia, and screening for syphilis. But the diagnostic tests, they are useful in symptomatic individual to establish diagnosis, or asymptomatic individual with positive screening test, and they are usually more expensive than the screening test, like the glycated hemoglobin, peripheral smear histology, and antibody for syphilis, for example. We have more classification based on the hospital lab service. For example, we have hematological investigation, microbiological, chemical investigation, immunological, histopathology, or cytopathological investigation, and these are according to the different lab and different service they are providing. And these are just to show you different, for example, tubes we are using for laboratory investigation, examining the red blood cells under the microscope. This is the strip for urine. In different type of labs, we have different investigation each lab is providing. For example, in hematology lab, this lab deals with investigation of abnormalities in blood cells, their precursor, and the hemostatic and clotting mechanism. In microbiology, in this discipline, fluid, mucosal surface, or tissues are examined by using microscopical, culture, and serological technique to identify a causative microorganism and the different kind of treatment or sensitive antibiotic for this kind of organism. And these are different machines or instruments we are using in the lab. This one is for automated cell counter. This one is for ESR or erythrocyte sedimentation rate. This one is semi-automated one for coagulation system, and this one for blood gases and electrolytes, and this one flow cytometry machine. This is Vision for having automated capture of morphology, and this is the automatic stainer one. As I told you, these are the different shapes of cultures and sensitivity. As a chemical pathology or the biochemistry or the clinical chemistry investigation, these are the one dealing with the metabolic abnormality of the body in disease states. These investigations carried out by assay of various normal and abnormal compounds found in body fluid, like the blood, urine, and CSF, saliva, or whatever specimen we are receiving in our lab. The immunology one is the one or investigation or the one lab dealing with the detection and any abnormality of the immune system. The primary role is to identify a disease, is observing the presence of an antibody in the patient that resulting from infection. This is just a preliminary thinking. We have different list of immunological and biochemical investigation that done in every lab. The histopathology is the one dealing with the identification of changes in diseased tissue through microscopic examination of appropriately stained tissue sections obtained from biopsy procedures. Cytopathology is the lab or the investigation dealing with the individual cell or cell types in disease, the clinician collects a sample with abnormal cells from different lesions, or scraping or aspiration or whatever source of abnormal tissue, and cells are stained and studied under the microscope. We have another type of classification based on the frequency. We have frequently used, occasionally done, and rarely ordered one. And actually list under each type of classification is not fixed. It's depending upon the different clinical service we are providing. For example, for an oncology center, we have frequently used one and occasionally done one and rarely ordered one. In, for example, gastroenterology center, we have another list of investigation under each type of category. In, for example, urology center, we have different type of investigation listed under each category. So it's depending upon which clinical service we are providing. We have different list of frequently, occasionally, and rarely ordered investigation. Going to the next part of our lecture is crucial questions answer prior or preliminary questions answered before any laboratory investigation. Or in another words, we are dividing into we have different stages of laboratory investigation, which is we call pre-analytical, analytical, and post-analytical one. What are the previous step or the preliminary or steps we are doing before any laboratory investigation? So we have to ask ourselves first as a clinician or a physician, which investigation is appropriate. The plan of investigation should be decided from the fact obtained from the history and the clinical examination. It should not be a ready-made list that we are ordering for every patient. No, the preliminary list of investigation should be depending or different from each patient to another according to the history and the clinical examination, in order to get the most benefit from the result we are getting from the lab. Investigations are useful only when the appropriate tests are requested and interpreted in the light of history, clinical finding, knowledge, and experience. So, if we have a request for investigation, we should properly giving the lab personnel or the lab physician, we are suspecting of blah blah blah, the patient is suffering from whatever condition, so we are ordering this investigation. Please help me to differentiate the diagnosis for this patient, confirm the diagnosis. So the request should be very fulfilled and providing a lot of information. Before any investigation are initiated, we should obtain consent from the patient if he is an adult one, and from the parent or guardian if the patient is a child. What sample should be collected? This is actually one of the most important pre-analytical or preliminary steps before ordering any lab investigation. The sample should be optimally the most likely entity which harbors a causative organism or abnormal constituent of body fluid like electrolyte or chemical compounds or even antigen. So according to the investigation, I have to provide the lab the most specific sample that can give me the most informative results. Also, success or failure of the investigation depend on the procedure carried out in collection, preservation, and transportation of the specimen. In cases of microbiological and culture tests, the specimen must be material from the actual site of infection and should be collected with minimal contamination from the adjacent tissues and secretion. Apart from this, the timing or when the sample is obtained or whatever time the specimen collection is also important. So we have, as a clinician, or before sending or ordering a specimen withdrawal to the lab, we have to know the precautions for each test. For example, like the microbiological investigation, for example, for cytological examination, we have to check what are the requirements for the proper sample. If I provide the lab a proper sample according to the procedures they are providing us, I can get the best result that can help me to diagnose or help me to deal with the patient. Also, what information should be given to the laboratory? Specimen should accompany properly filled out form from the clinician, having the preliminary details including the name, hospital number, gender, and date of birth. Other important details like the nature of the specimen, source of the specimen, the exact exactly exactly the investigation requested, the time and date of specimen collection, a brief summary about the clinical detail, tentative or like my differential diagnosis as a clinician, the current therapy if the patient is receiving any therapy that may affect the result should be listed with the sample. Interpretation of results. Clinician knowledge of pathology is essential for interpreting results. The normal value may vary between different lab settings. Hence, communication with laboratory personnel become very important in these settings. So the interpretation is like a collaborative action between the physician and the laboratory personnel or the laboratory personnel. The laboratory investigation. What are the most common investigation ordered in each setting or in different diagnoses? CBC, which is called complete blood count with or without differential, basal metabolic panel, comprehensive metabolic panel. First, you have to know when we centrifuge a blood sample, we have three layers. The top layer is the plasma one. The bottom one is the red blood cells, and the puffy coat, which containing all the cellular component present in our blood, which is white blood cells and platelets. The CBC, it should be or stands for complete blood count with or without differential. We have to know that the peripheral venous blood is collected in a purple top tube contain EDTA, which is ethylene diamine tetraacetic acid. It's an anticoagulant, and the sample should be mixed gently and thoroughly in order to prevent clotting of the sample. If we have clotted sample or sample stayed on the bench for more than 48 hours, it should be rejected or unacceptable for investigation or doing complete blood count. The methodology of testing, we are using whole blood analyzer, and this test should be available 24/7 for hospitalized patients. Basal metabolic testing is a chemical panel where multiple chemistry tests are grouped as a single profile for ease of ordering, since this group of tests are often or medically necessary. The basal metabolic testing or tests include electrolyte and tests for kidney function. They are including sodium, potassium chloride, CO2, blood urea nitrogen, creatinine, and glucose and total calcium levels. They are collected in either green top tubes, which containing the heparin as an anticoagulant, or the yellow top tube, which contain gel at the bottom to separate the red blood cells and cellular component from the serum on centrifugation, or red top tube, which is a tube with no additive, the blood clots and serum separated by centrifugation. And actually, these basal metabolic tests should be available in hospitalized patient 24/7. The complete metabolic panels, including part of the basal metabolic panels, in addition to the bilirubin level, albumin level, liver enzymes, alkaline phosphatase, and total protein levels. Going next to the common clinical scenarios and what are the preliminary investigation and what are the occasional investigation ordered for this condition and what are the rare investigation we should think about this scenario, and if these investigations or lab results could help us to identify this type of patient or reach a final diagnosis. So this should be the aim of ordering a lab investigation. Here we have a patient presented with chronic fatigue, pallor, and dullness of the conjunctiva. So thinking of a preliminary of investigation should be a CBC or complete blood count, including hemoglobin, hematocrit level, red cell indices, and a differential leukocytic count or absolute leukocytic count. So these are the preliminary investigation, and from these results we can have a data that can help us to confirm or reject a diagnosis for this kind of patient. What are the occasionally ordered investigation in this kind of patient? For if we don't have preliminary useful results from the preliminary investigation, we have to order more sophisticated one by asking for a peripheral smear, serum iron, or total iron binding capacity. If we don't have final or reaching a proper diagnosis, we can order a Schelling test, which is a rarely ordered investigation in this condition. Another scenario, if we have a patient with recurrent bleeding episodes or persistent hemorrhage, what are the preliminary investigations should be ordered for this kind of patient? Platelet count, bleeding time, prothrombin time, and activated partial thromboplastin time. And if we have a conclusive result from the preliminary investigation, we can make a conclusion. If not, we can order a bone marrow aspirate biopsy. If we don't have a conclusive results from this occasional, we can go to the rarely ordered investigation in this condition, which is immunohistochemistry for the biopsied bone marrow. In conclusion, laboratory investigation have become an integral component of a complete examination of the patient, so it's not stand by himself is a laboratory investigation. It should be like interpreted in an integrated uh, uh, view of the clinical history, treatment conditions, and clinical examination of the patient. So it's like a cycle of should be completed by the laboratory investigation. They confirm the clinical impression and also provide a prognostic tool. We should have a thorough knowledge about the different investigation value to our field of study. We should also know how to correlate our history taking and clinical examination so as to order the most appropriate investigation. The final comments: excessive laboratory tests can cause iatrogenic anemia, and this thing we have to put in our mind, especially for hospitalized patients. Although the goal of ordering any blood test is to help the patient, repeated blood collection, particularly in hospitalized patients, are a common cause for anemia. Every test order, including laboratory tests on a patient, should be assessed for its benefit, risk, and true need, which is very important. No laboratory test should ever be ordered unless it is medically necessary. And these are the list of reference we can use, and thank you.